Hello, everyone, and welcome to Medicare 101. I'm Angie Patterson, and I'm thrilled to have you join me today. Medicare can seem complex, but don't worry, we're going to break it down into easy-to-understand basics. By the end of this webinar, you'll have a solid foundation of Medicare knowledge, so let's dive in and demystify Medicare together. Before we get started, let me introduce myself properly. As you can see, I love embracing life's adventures, just like I'm embracing this mountain view. I'm Angie Patterson, and I wear many hats. First and foremost, I'm a proud wife and mother. Professionally, I'm the founder of the Patterson Agency, where I've dedicated my career to becoming a Medicare, life, and health insurance expert. I'm also passionate about helping people prepare for their golden years as a retirement specialist. My goal is to use all of this expertise to guide you through the Medicare landscape. But enough about my professional life. Let me share a bit about what really drives me. This is my why, my amazing family. These are the people who inspire me every day to do what I do. Just like I want the best for my family, I want the best for you and your loved ones. That's why I'm so passionate about helping people understand Medicare. It's not just about insurance. It's about ensuring you and your family have peace of mind about your health care as you age. Now that you know a bit about me and what motivates me, let's start our Medicare journey together. Let's begin with the foundation of it all, Original Medicare. I've helped many clients navigate this system. Original Medicare is the starting point for understanding your health coverage options as you approach 65 or deal with certain disabilities. It's comprised of two main parts, which we'll explore in detail. But remember, understanding Original Medicare is crucial because it forms the basis for all other Medicare decisions you'll make. Okay, let's get started. Now let's break down the two main components of Original Medicare, Part A and Part B. First, we have Part A, which is your hospital coverage. You can see the image of a hospital here. The great news is that for many people, Part A comes with a $0 monthly premium. But there's an important caveat. This $0 premium applies only if you or your spouse have worked and paid Medicare taxes for at least 40 quarters. That's about 10 years of work. If you haven't met this requirement, you'll need to pay a premium for Part A. Next, we have Part B, represented here by the image of a doctor. This covers your doctor visits and other medical services. Now here's a crucial point to remember. Part B always comes with a premium, and as of 2023, the standard monthly premium is $174.70. I want to emphasize this because it's a cost you'll need to factor into your healthcare budget. However, keep in mind that this amount is based on your income. If your income is above certain thresholds, you might pay a higher premium for Part B. So, no matter which Medicare plan you ultimately choose, you'll be paying at least this $174.70 monthly premium for Part B, and potentially more depending on your income level. Now that we understand the basic structure and costs of Original Medicare, let's look at some common enrollment scenarios. This will help you understand when and how you might enroll in Medicare depending on your specific situation. As we dive into Medicare enrollment, it's important to understand that your personal situation will determine how and when you enroll. Let's look at three common scenarios that most people will fall into. Scenario number 1. You are currently receiving Social Security benefits. This is a straightforward situation, but it does have some implications for your Medicare enrollment. Scenario number 2. You are not receiving Social Security benefits. This scenario requires a bit more action on your part, and we'll discuss why in a moment. Scenario number 3. You're still working and covered by your employer's health plan. This is becoming increasingly common as more people work beyond the traditional retirement age, and it can affect your Medicare decisions. Each of these scenarios has its own set of rules and considerations. Over the next few slides, we'll break down each one in detail. This will help you identify which scenario applies to you and understand exactly what steps you need to take. Remember, regardless of which scenario you fall into, it's crucial to be aware of your enrollment periods to avoid any late enrollment penalties or gaps in coverage. Let's start by looking at scenario number 1 in more detail. Let's dive into our first enrollment scenario. You're already receiving Social Security benefits when you become eligible for Medicare. If this is you, you're in luck. The process is pretty straightforward. Here's what happens. First, you'll be automatically enrolled in Original Medicare. That means both Part A and Part B. There's no need for you to take any action to initiate this enrollment. It happens seamlessly. About 3 months before your 65th birthday, you'll receive your Medicare ID card in the mail. This card is your proof of insurance, so keep it in a safe place. You'll need it when you visit healthcare providers or facilities. Now remember that Part B premium we talked about earlier? Here's how that works in this scenario. The standard premium of $174.70 will be automatically deducted from your monthly Social Security check. This ensures you don't have to worry about making separate payments for your Medicare coverage. It's important to note that while this automatic enrollment is convenient, you still have choices to make. You'll need to decide if you want to stick with Original Medicare or explore other options like Medicare Advantage plans or adding a supplemental policy. But don't worry, we'll cover those options later in our presentation. The key takeaway for Scenario 1 is this. If you're already on Social Security, Medicare enrollment happens automatically, but you still need to be prepared to make some decisions about your coverage. Now, let's move on to Scenario 2. You're eligible for Medicare, but you're not currently receiving Social Security benefits. This situation requires a bit more action on your part. In this scenario, you must manually enroll in Original Medicare. The good news is, you have several options for how to do this. First, you can enroll online. The process is straightforward through the Social Security Administration's website at SSA, Gov, Benefits, Medicare. This is often the quickest and most convenient option for many people. If you prefer to speak with someone directly, you can enroll over the phone by calling 1-800-772-1213. This can be helpful if you have questions during the enrollment process. For those who prefer face-to-face interactions, you can visit your local Social Security office in person to enroll. This might be a good option if you have complex questions or need more personalized assistance. Lastly, if you're more comfortable with traditional methods, you can mail in your application to the Social Security Administration. Now here's an important point about payments in this scenario. Since you're not receiving Social Security benefits, you won't have the Part B premium automatically deducted. Instead, you'll be billed quarterly for Part B. That means you'll pay $524.10 every 3 months, which is $174.70 times 3. Remember, it's crucial to enroll during your initial enrollment period to avoid late enrollment penalties. This period includes the 3 months before your 65th birthday, your birthday month, and the 3 months after. Mark these dates on your calendar. The key takeaway for Scenario 2 is this. If you're not on Social Security, you need to be proactive about enrolling in Medicare and be prepared to pay your premiums directly. Now, let's discuss Scenario 3, which is becoming increasingly common. You're turning 65, but you're still working and covered by your employer's health plan. This scenario offers you some flexibility, but it's important to understand your options. In this situation, you have 2 main choices. Option 1. You can enroll in Medicare effective on your 65th birthday. This means you'll have both your employer's coverage and Medicare. For some people, this dual coverage can provide additional benefits and peace of mind. However, it's important to consider whether the extra cost of Medicare premiums makes sense for your situation. Option 2. You can choose to delay Part B of Medicare until you retire. This is often a good choice if you have good health coverage through your employer and want to avoid paying the Part B premium while you're still working. It's crucial to note that even if you delay Part B, you should still enroll in Part A when you turn 65 if it's premium-free for you. Part A can serve as secondary insurance to your employer plan for hospital stays and usually doesn't cost you anything. Now here's a very important point. If you choose to delay Part B, you'll need to enroll during a special enrollment period when you do retire or lose your employer coverage. This period lasts for 8 months after your employment or coverage ends, whichever happens first. Missing this window could result in penalties. Also, be aware that if your employer has fewer than 20 employees, different rules may apply, and you might need to enroll in Medicare at 65 to avoid coverage gaps. The key takeaway for scenario 3 is this. If you're still working with employer coverage at 65, you have options. You can enroll in full Medicare or just Part A, or delay Part B. Your choice should depend on your specific situation, including the quality of your employer coverage and your overall health needs. Now that we've covered the various enrollment scenarios, let's talk about when your Medicare coverage actually begins. This is an exciting moment in your Medicare journey, symbolized by this birthday cake on our slide. For most people, your original Medicare coverage, that's both Part A and Part B, begins on the first day of your birthday month. It's like Medicare is giving you an extra birthday present. But here's a crucial point I want to emphasize. If your birthday happens to fall on the first day of the month, you get a special treat. In this case, your Medicare coverage actually starts on the first day of the previous month. So, if you were born on July 1st, your coverage would begin on June 1st. It's like getting an early start on your Medicare benefits. This timing is important to keep in mind as you plan your transition to Medicare. It ensures you don't have any gaps in your health coverage, especially if you're retiring or leaving other health insurance as you turn 65. Remember, whether your coverage starts on the first of your birthday month or the month before, it's essential to plan ahead. Make sure you've completed your enrollment process in time for your coverage to begin when you need it. The key takeaway here is to mark your calendar. Your Medicare coverage starts on the first of your birthday month, unless you're a first of the month baby, in which case it starts a month earlier. Now that we understand how to enroll in Original Medicare, let's talk about something crucial: the major financial exposures you might face with Original Medicare alone. This is important because many people don't realize that Original Medicare doesn't cover everything. Let's start with Part A, your hospital coverage. While you might have a $0 premium, there's still a significant deductible to consider. For each hospital stay, you're responsible for a deductible of $1,132. This isn't an annual deductible. It applies to each separate hospital stay. So, if you have multiple hospital visits in a year, you could end up paying this deductible multiple times. Moving on to Part B, which covers your doctor visits and other medical services, there are 3 key points to understand. First, there's an annual deductible of $240. This is the amount you'll pay out of pocket at the beginning of each calendar year before your Part B coverage kicks in. Second, and this is a big one, after you meet your deductible, you're responsible for 20% coinsurance on all Part B services. Now here's the kicker. There's no limit to this 20%. If you have a year with high medical expenses, that 20% could add up to a substantial amount. Lastly, we need to talk about something called Part B excess charges. Some doctors don't accept the Medicare-approved amount as payment in full. They're allowed to charge up to 15% more than the Medicare-approved amount, and guess who's responsible for that extra 15%? That's right, it's you. These exposures are why many people choose to supplement their original Medicare with additional coverage, which we'll discuss later in our presentation. The key takeaway here is that while Original Medicare provides valuable coverage, it does leave you with potentially significant out-of-pocket costs. Understanding these exposures is crucial for planning your healthcare budget in retirement. Now that we've covered the basics of Original Medicare and its potential financial exposures, it's time to explore 2 popular ways to enhance your coverage: Medicare supplement plans, also known as Medigap, and Medicare Advantage plans. These 2 options represent different approaches to filling the gaps in Original Medicare, and understanding the difference between them is crucial to making the best choice for your healthcare needs. Medicare supplement plans work alongside your Original Medicare, helping to cover some of those out-of-pocket costs we just discussed. They're designed to supplement your existing coverage. On the other hand, Medicare Advantage plans are an alternative way to receive your Medicare benefits. These plans are offered by private insurance companies and bundle your Part A and Part B coverage, often including additional benefits like prescription drug coverage or dental and vision care. Both options have their pros and cons, and the right choice depends on your individual health needs, budget, and preferences. In the next few slides, we'll dive deeper into each of these options. We'll explore how they work, what they cover, and what you need to consider when deciding between them. This comparison will help you understand which option might be the best fit for your unique situation. Remember, there's no one-size-fits-all solution in Medicare. Our goal is to give you the information you need to make an informed decision about your healthcare coverage. Let's take a moment to visualize your Medicare coverage choices. As you can see, we have two main paths here: Original Medicare on the left and Medicare Advantage on the right. It's important to understand that you'll choose one path or the other. You can't have both simultaneously. Starting with Original Medicare on the left, you have two core components: Part A for hospital insurance and Part B for medical insurance. These are the foundations of Medicare that we discussed earlier. Now, if you choose Original Medicare, you have the option to enhance your coverage. You can add two important pieces: a Medicare supplement plan, also known as Medigap, which helps cover some of those out-of-pocket costs we talked about earlier. Part D, prescription drug coverage, which helps with the cost of your medications. These additions can provide more comprehensive coverage and potentially lower your out-of-pocket expenses. On the right side, we have Medicare Advantage, also known as Part C. This option combines Part A and Part B into one plan offered by a private insurance company. It's an all-in-one alternative to Original Medicare. Most Medicare Advantage plans include prescription drug coverage, similar to Part D. If a plan doesn't include drug coverage, you may be able to add it, depending on the specific plan type. It's worth noting that Medicare Advantage plans often include additional benefits not covered by Original Medicare, such as dental, vision, or hearing coverage. The key takeaway here is that you have choices. You can go with Original Medicare and potentially add supplemental coverage, or you can choose a Medicare Advantage plan for an all-in-one approach. Your decision will depend on factors like your health needs, budget, preferred doctors, and how you want to manage your health care. In the next few slides, we'll dive deeper into the pros and cons of each option to help you understand which might be the best fit for you. Now, let's compare Medicare Supplement and Medicare Advantage plans side by side. We'll start with Medicare Supplement plans. For Medicare Supplement plans, the price includes your Part B premium of $174.70 plus the cost of the supplement plan, which varies. These plans offer the lowest out-of-pocket costs when seeing doctors or staying in hospitals. You can choose any doctor contracted with Medicare anywhere in the USA, and you don't need referrals. For prescription coverage, you'll need to choose a standalone Part D plan. We'll compare this with Medicare Advantage in just a moment. Now, let's look at the details for Medicare Advantage plans. The price also includes your Part B premium of $174.70, plus the cost of the Advantage plan, which varies. These plans typically have higher out-of-pocket costs for doctor visits and hospital stays compared to supplement plans. You must choose doctors within the plan's network. Part D prescription drug coverage is typically included in the plan. Many Advantage plans offer extra benefits like dental, vision, gym memberships, and over-the-counter benefits. These differences can significantly impact your healthcare experience and costs. Let's summarize the key differences between Medicare Supplement and Medicare Advantage plans. Medicare Supplement plans offer more predictable and often lower out-of-pocket costs, greater flexibility in choosing healthcare providers, the need to purchase a separate Part D plan. Medicare Advantage plans offer potentially lower monthly premiums, all-in-one coverage, including Part D. In most cases, extra benefits not covered by Original Medicare, but they also come with network restrictions and potentially higher out-of-pocket costs when you receive care. The choice between these two options depends on your personal preferences, health needs, and financial situation. Some people prefer the predictability and flexibility of a Medicare supplement plan, while others appreciate the all-in-one nature and extra benefits of Medicare Advantage plans. Remember, there's no one-size-fits-all solution. The best choice for you depends on factors like your health status, budget, preferred doctors, and how you want to manage your health care. It's also worth noting that your needs may change over time, so it's important to review your coverage annually. Now that we've covered the main Medicare options, let's talk about an important additional layer of protection: cancer and heart attack or stroke coverage. As a Medicare beneficiary, it's crucial to understand that while Medicare provides valuable health coverage, it doesn't cover everything. This is particularly true when it comes to serious illnesses like cancer, heart attacks, or strokes. I want to emphasize a strong recommendation here. We advise every Medicare beneficiary to consider cancer coverage. Here's why. If you're diagnosed with cancer, you will likely face out-of-pocket expenses that Medicare doesn't cover. These costs can vary significantly depending on your diagnosis and treatment path. They might include things like experimental treatments, certain medications, home health care, or even travel expenses for treatment. The financial burden of cancer treatment can be substantial, even with good Medicare coverage. Cancer coverage can provide an extra financial cushion, allowing you to focus on your recovery rather than worrying about medical bills. Similarly, heart attack and stroke coverage can offer additional financial protection for these serious health events. These policies typically provide a lump sum payment upon diagnosis, which you can use for medical expenses, rehabilitation costs, or any other purpose. It's important to note that the amount of coverage you might need can vary based on your individual circumstances, health history, and risk factors. That's why it's crucial to discuss these options with a licensed insurance professional who can help tailor a plan to your specific needs. Remember, the goal here is to provide you with comprehensive protection and peace of mind. By considering these additional coverage options, you're taking a proactive step in safeguarding your health and finances against some of life's most challenging health events. Now that we've discussed Medicare Supplement, Medicare Advantage, and additional coverage options for cancer and heart attack or stroke, let's turn our attention to an important aspect of Medicare that many beneficiaries need to understand: skilled nursing facility coverage. Skilled nursing care is often required after a hospital stay, for rehabilitation, or for complex medical care that can't be managed at home. Medicare does provide coverage for this, but it's crucial to understand the details and potential costs involved. Under Original Medicare Part A, here's how the coverage breaks down. For the first 20 days in a benefit period, you pay nothing. However, it's important to note that if you're on a Medicare Advantage plan, you may be charged co-payments during these first 20 days. This is one of those differences between Original Medicare and Medicare Advantage that we discussed earlier. From days 21 to 100, you'll be responsible for a daily co-payment of $204. This can add up quickly, so it's something to be prepared for. After day 100 in a benefit period, Medicare coverage ends, and you're responsible for all costs. This is a critical point to understand, as extended stays in a skilled nursing facility can become very expensive. It's also crucial to note that Medicare Part A limits SNF coverage to 100 days in each benefit period. This means that if you need care beyond this point, you'll need to consider other payment options or coverage. Now, I want to emphasize a very important point here. Your doctor or other healthcare provider may recommend services more frequently than Medicare covers, or they may suggest services that Medicare doesn't cover at all. In these situations, you may have to pay some or all of the costs out of pocket. This is why it's absolutely essential to ask questions and fully understand why your doctor is recommending certain services and whether or how much Medicare will pay for them. Don't be afraid to have these conversations with your healthcare providers and your insurance representative. Understanding these details about skilled nursing coverage can help you better prepare financially and make informed decisions about your care. In our next slide, we'll discuss some strategies for managing these potential costs and ensuring you have the coverage you need. Let's turn our attention to the Medicare MU 2024 official U.S. Government Medicare Handbook, specifically page 28. This section highlights some critical exposures that every Medicare beneficiary needs to be aware of. The handbook emphasizes an important point. Your status as an inpatient or outpatient can significantly impact your coverage and out-of-pocket costs. Each day of your hospital stay, you or your caregiver should always confirm with the hospital staff whether you're classified as an inpatient or outpatient. Why is this so crucial? If you're under observation as an outpatient for more than 24 hours, you'll receive a Medicare Outpatient Observation Notice, or MOON. This notice explains how your outpatient status affects what you pay in the hospital and for care after you leave. This classification can lead to unexpected out-of-pocket expenses that you might not be prepared for. Moreover, your hospital status directly impacts your eligibility for skilled nursing facility care coverage. Medicare requires a 3-day minimum medically necessary inpatient hospital stay to qualify for this coverage. If you're classified as an outpatient under observation, even for 3 days or more, you won't meet this requirement. This exposure could leave you responsible for the full cost of any needed skilled nursing care. These potential gaps in coverage highlight significant financial exposures that Medicare beneficiaries face. The handbook is alerting us to these risks, but it's up to us to take action to protect ourselves. This brings us to our next slide, where we'll discuss a powerful solution to address these exposures. Let's talk about umbrella coverage options. Umbrella coverage is designed to eliminate major exposures like the ones we've just discussed. These policies can provide an extra layer of protection, filling in the gaps where original Medicare or even Medicare Advantage plans might leave you vulnerable. In the next slide, we'll explore how umbrella coverage options can offer you peace of mind by addressing these potential financial risks and ensuring you're protected against unexpected healthcare costs. Now that we've identified the potential exposures in Medicare coverage, let's explore 3 comprehensive umbrella coverage options designed to eliminate these major risks. These packages offer different levels of protection, allowing you to choose the one that best fits your needs and budget. On the far left, we have umbrella package number 3, our most comprehensive option. This package includes a Medicare plan with prescription coverage cancer, heart, and stroke, CHS coverage, dental, vision, and hearing, DVH, hospital indemnity plan, HIP, recovery care. In the middle, we see umbrella package number 2, which offers a Medicare plan with prescription coverage cancer, heart, and stroke, CHS coverage, dental, vision, and hearing, DVH, hospital indemnity plan, HIP. On the far right is umbrella package number 1, our basic option, which includes a Medicare plan with prescription coverage, cancer, heart, and stroke, CHS coverage. Let's break down these components. The Medicare plan with prescription coverage forms the foundation of each package, ensuring you have your essential health and medication needs covered. All 3 packages include cancer, heart, and stroke coverage. As we discussed earlier, this additional layer of protection is crucial for managing the potential high costs associated with these serious conditions. Packages number 2 and number 3 add dental, vision, and hearing coverage, along with a hospital indemnity plan. These address common gaps in Medicare coverage, providing financial support for these essential services and additional assistance during hospital stays. Uniquely, package number 3 includes recovery care. This component is designed to provide support during your recovery period, potentially covering costs associated with skilled nursing care or home health care that might not be fully covered by Medicare. By offering these tiered options, we're providing you with the flexibility to choose the level of coverage that best suits your individual needs and circumstances. Remember, the goal is to eliminate those major exposures we discussed in the Medicare handbook, ensuring you're protected against unexpected healthcare costs and gaps in coverage. Now that we've explored these comprehensive umbrella coverage options, let's dive deeper into one of the foundational components, Medicare supplement plans. These plans, also known as Medigap policies, play a crucial role in filling the gaps left by original Medicare. Let's dive into our first option, Medicare supplement plans. These plans are designed to work alongside original Medicare to provide more comprehensive coverage. Before we explore Medicare supplement plans, it's crucial to understand the major exposures of original Medicare. For Part A hospital coverage, there's a deductible of $1,632 for each hospital stay. Under Part B doctor coverage, you face a $240 calendar year deductible plus a 20% coinsurance with no upper limit. Additionally, you might be responsible for Part B excess charges, which can be up to 15% extra. These exposures can lead to significant out-of-pocket costs. Option 1 combines 3 key components: original Medicare, Parts A and B, a Medicare supplement plan, and a prescription drug plan. The Medicare supplement, also known as Medigap, is private health insurance that covers some or most of original Medicare's out-of-pocket expenses. The prescription drug plan, or Part D, is offered by private insurance companies to provide RX coverage. Let's focus on the Medicare supplement component. These plans, also called Medigap, are designed to fill the gaps in original Medicare by covering deductibles, co-insurance, and co-pays. There are several Medigap plans available, each offering different levels of coverage. It's important to note that plans G and N currently offer the most comprehensive coverage, as plans C and F are no longer available to new Medicare beneficiaries. Even with a Medicare supplement plan, it's crucial to understand that there's still a gap when it comes to skilled nursing coverage. This remains an area where you might face out-of-pocket expenses. Now, let's talk about costs. The average monthly premium for Plan G, one of the most comprehensive plans available, ranges from $100 to $200, depending on your location and the insurance company you choose. When deciding between Medicare supplement plans, many people consider Plan G and Plan N. Plan G has a premium of $100 to $200 per month, and you're responsible for the Medicare Part B deductible of $240 per calendar year in 2024. Plan N is typically about $20 cheaper per month, but you'll have additional out-of-pocket costs. These include the Part B deductible, copays for doctor visits and ER visits, and potential Part B excess charges. The choice between these plans depends on your healthcare needs and budget. If you visit doctors frequently or want more predictable costs, Plan G might be the better option. If you're willing to take on some copays to save on monthly premiums, Plan N could be a good choice. In our next slide, we'll cover some key points about Medicare supplements. Let's review some key points about Medicare supplements. First, the best time to enroll is 6 months prior to your birthday month. This ensures you get the cheapest rates, avoid mistakes, and can check it off your list. Secondly, remember that these plans are standardized and federally regulated. The coverage follows the letter of the plan, not the company offering it. So, a Plan G from one company offers exactly the same coverage as a Plan G from any other company. We work with a wide range of Medicare supplement companies. Our role is to work for you, not the carriers. We search through your options to find the plan that best fits your needs. Remember, it's not one size fits all. We're your advocate in this process. Now let's address some common myths about working with a broker. Myth number 1, you must pay a fee to use a broker. The truth is, we charge no fees for our services. Myth number 2, insurance companies charge higher prices if you go through a broker. In reality, you pay exactly the same price whether you use our help or go it alone. The insurance companies pay us directly for educating you and helping you enroll. Myth number 3, brokers are biased towards certain companies. The truth is, we have access to over 25 different companies and get paid by whichever one you choose, so we aren't biased towards any particular company. To summarize, you pay no fees, the price is the same with or without a broker, and with over 25 companies to choose from, we remain unbiased. Our goal is to find the best fit for you. Let's move on to discuss prescription drug coverage. As we mentioned earlier, this is a crucial component of your Medicare coverage. Private insurance companies offer Part D drug plans, which you enroll in separately to obtain prescription drug coverage. Part D coverage has 3 stages in 2025. The deductible stage, with a deductible of $590. The initial coverage stage, where you pay 25% of the cost of your covered drugs until you reach the out-of-pocket limit of $2,000. The catastrophic coverage stage, where you no longer pay out-of-pocket costs once you reach the limit. It's important to note the changes from 2024 to 2025. The coverage gap stage has been removed, and the out-of-pocket maximum has been reduced from $8,000 to $2,000, which is a significant improvement for beneficiaries. In our next slide, we'll discuss an important consideration, the late enrollment penalty for Part D. Understanding this penalty is crucial to avoid unnecessary costs and ensure you have the coverage you need when you need it. Now, let's talk about something important, the Part D late enrollment penalty. If you don't enroll in Part D when you're first eligible and don't have other creditable coverage, you might face a penalty. The formula is simple. It's 1% of the national base beneficiary premium, multiplied by the number of months you went without coverage. This penalty can add up, so it's crucial to enroll on time or have equivalent coverage. Speaking of Part D, let's walk through our process for helping you choose the right plan. At our agency, we've developed a straightforward 5-step process to ensure you get the best Part D coverage. First, we input your drug list into Medicare's online calculator. Then, we help you choose your preferred pharmacy. Next, we compare all plan options available in your zip code. Once we've found the best fit, we assist you in enrolling in the plan of your choice. Finally, we make sure to reevaluate your coverage each year during the annual election period from October 15th to December 7th. This process ensures you always have the most suitable coverage for your needs. Now that we've covered Part D, let's recap Option 1, Original Medicare. Option 1 is Original Medicare, which consists of 3 main components. First, we have Original Medicare itself, with a Part B premium of $174.70 per month. Then, there's the Medicare supplement, such as Plan G, which varies by zip code. Lastly, we have the prescription drug plan, with costs that vary but typically run around $1 per month. This combination provides comprehensive coverage for many beneficiaries. But that's not the only option available. Let's move on to discuss Option 2, Medicare Advantage. Now, we're going to explore Option 2, Medicare Advantage. This is an alternative way to receive your Medicare benefits, and it has some unique features we'll dive into next. Medicare Advantage plans are managed care plans that must include all Part A and B services. Many plans also include Part D prescription coverage. One attractive feature is that plans can be as low as $0 premium per month, although you must still pay your $174.70 Part B premium. These plans typically involve co-pays, deductibles, coinsurance, and out-of-pocket maximums. It's important to note that we always recommend an umbrella coverage, such as hospital indemnity, to provide additional protection. So, how do you choose the right Medicare Advantage plan? Let's break it down. When choosing a Medicare Advantage plan, there are 3 key factors to consider. First, your zip code, as plans vary by location. Second, make sure your preferred doctors, hospitals, and medications are covered. Lastly, look at the extra benefits offered, such as gym memberships, dental and vision coverage, and over-the-counter benefits. These can add significant value to your plan. Now that you know what to look for, let's discuss when and how to sign up. There are 2 main periods to be aware of when it comes to Medicare enrollment. The initial enrollment period occurs when you turn 65. If you want your plan to start on the first day of your birthday month, you need to sign up in one of the 3 months before turning 65. Then there's the annual election period, which runs from October 15th to December 7th each year. This is when you can change plans if needed, with new coverage starting January 1st. Now that we've covered both Original Medicare and Medicare Advantage, let's compare these 2 options side by side. When comparing Medicare Supplement and Medicare Advantage, there are several factors to consider. Medicare Supplement plans have the Part B premium plus the supplement plan cost. They offer the lowest out-of-pocket costs when seeing doctors or hospitals, and you can choose any doctor contracted with Medicare in the USA without needing a referral. You'll need to choose a standalone prescription drug plan. On the other hand, Medicare Advantage plans have the Part B premium plus the Advantage plan cost. They typically have higher out-of-pocket costs when seeing doctors or hospitals, and you must choose specific doctors contracted with the plan. Part D coverage is usually included, and these plans often offer extra benefits like dental, vision, gym memberships, and over-the-counter benefits. Now, regardless of which option you choose, it's important to consider additional protection. let's revisit the umbrella coverage options. As we discussed earlier, umbrella coverage options are crucial for eliminating major exposures. These options provide an extra layer of protection, giving you peace of mind and financial security. Remember, it's always better to have coverage and not need it than to need it and not have it. As we near the end of our Medicare discussion, it's important to touch on a related topic: protecting your money in retirement. Retirement isn't just about healthcare, it's also about maintaining the lifestyle you've become accustomed to. That's why we offer additional services to help protect your money and ensure a comfortable retirement. Let's take a quick look at some safe money retirement options. When it comes to retirement savings, there are three main categories to consider. First, we have employer-provided plans like 401ks, SEPs, Roth IRAs, and 403bs. Then there are market-driven accounts such as brokerage accounts, mutual funds, and individual stocks. Lastly, we have liquid accounts like savings, checking, and low-interest CDs. Each of these plays a role in a well-rounded retirement strategy. Now, let's focus on some key aspects of safe money retirement planning. When planning for a safe money retirement, there are three crucial elements to consider. First, principal protection ensures your initial investment is 100% protected from loss or market risk. Second, you have growth options, choosing from 100% guaranteed fixed rates or indexes with larger growth potential. Lastly, there are various income and withdrawal options available to suit your specific needs in retirement. As we wrap up, I want to outline our three-phase approach to helping you navigate Medicare and retirement planning. Our process consists of three phases. Phase 1 is Medicare education, which includes resources like our online platform, today's educational seminar, and a free copy of our Medicare breakdown book. Phase 2 is enrollment advice, where we offer a free consultation to discuss your specific situation and provide a personalized Medicare roadmap and cost summary. Phase 3 is lifetime support, setting us apart with free lifetime billing and claim service, plus annual reviews to ensure your coverage always meets your needs. Now let's focus on your next steps. Your next step is to schedule your free consultation. This is where we'll discuss your specific situation and help you choose the right plans for your area and life circumstances. You'll also receive our bonus item, a personalized Medicare roadmap and cost summary, giving you a step-by-step action guide and an outline of your total monthly costs. Don't wait. Click Book Now to schedule your call and take control of your Medicare journey today. Thank you for attending this Medicare educational seminar. We look forward to helping you navigate your Medicare options and secure a comfortable retirement. Remember, we're here to support you every step of the way. Book your consultation now, and let's get started on your personalized Medicare plan.